let us have a fundamental necessity of a data for a care provider. If somebody is going to give a permission to access your financial data, it's a complicated one. Nobody wants to share. That is the right way we evolved over a period in the modern society. Whereas to any patient, if their care provider or a doctor, they will not hesitate to share the data with them because it is their well-being. It is very clearly driven. So my view is it's a very, very different paradigm when you come to the data privacy and the personal data, individual data, how we need to manage. Currently, the recent times in India, I'm speaking for India because that is the main focus. See, currently there are a lot of data privacy act has been enacted, and then there are certain guidelines has been given. Most of it is considered with the consent, right? It is today the healthcare consent related legal framework for data, which is, it is like how you accept for cookies in your app, because under necessity, you're going to say, okay, I'm going to accept I'm going to consent for surgeries to data access to data privacy situation. But we need to really do on the opposite side. See, whenever we hire a lawyer, we give the power to the lawyer to represent you. We need to really mature our legal framework. This is my view. This is an individual, independent view. The healthcare delivery thought process has to view the health professionals and the doctors are really a partner and helping the patient to really have their well-being. To do that, the legal framework we need to really evolve. So this is my view on the data privacy piece. Then the data security, which you mentioned, which is very different problem here. The different problem in data security here, which we always assume that data security on a digitization manner, somebody is going to give the data to somebody and then they are going to really manage it happen. But the problem what is happening in India is opposite. Getting the data out of an IT system to a centralized model is a huge challenge, and we've never been successful. Of course, some of the Western world, they're able to really necessitate with an EHR and HIE standards and then bring it in. But India, we have not been successful. I've seen only once we have become very successful in collecting data, where government has mandated during COVID for every lab and every practitioner to share the data to ICMR. Otherwise, the data sharing, and then from 2005, we have been watching how the repositories are created, the registries are created, which is not very successful. So for me, if you're able to create a proper data security, technology is available again, data security framework for data sharing, and ensure that every IT system should be following that security protocol and accessing this kind of an API is very critical, and which we have done in UPI, we have done in most of the financial data today from the government side. And we should bring the same practice over here. I believe our digital health mission is following the same standard.